Hi, I'm Dr. Sharyl Truty, owner of a practice here in Northeast Florida called Balanced Physician Care here in Jacksonville Beach and Ponte Vedra Beach, Florida. Today it is March 20th, 2020, and we are doing just a COVID-19 update for our community for both the patients that are a member of our practice here at Balanced with the D physiciancare.com and for the general community that we serve. We want to be a source of positive and truthful information for all of those people here in our local community so you can understand what's going on locally. I know there's a lot of news nationally and state-wise, but we want to keep you up to date on what's going on locally. So locally here, the cases that have been published as of this morning in Duval County are 15 cases of the COVID-19 virus, and the total number of cases in St. Johns County has been 5. So far here for us in Northeast Florida, we've only had some scattered, isolated cases. Again, for the main symptoms of the COVID virus are fever, dry cough, and fatigue. And those continue to be the main symptoms that if you are getting sick, that us as providers are going to hone in on to decide what is going on. So if you are, we have a lot of allergies going on right now in Florida. So if you're feeling like you've got a lot of nasal congestion and sore throat, and that's causing a little bit of cough, you might be getting anxious as far as whether something like this if you're getting sick. Again, our main hallmarks for this are going to be fever, cough, and that cough is usually dry, as well as fatigue. There are some minor sore throat and maybe some diarrhea that might be associated with it, but these are going to be the main symptoms, along with your travel history. If you obviously have traveled out of Northeast Florida in the past couple of weeks, that may herald us to be a little bit more concerned about whether you might have a COVID positive upper respiratory infection rather than a typical cold or a sinusitis or allergies that are going on. If you've traveled outside of Northeast Florida, our hotspots in Florida have tended to be in the southern part of the state for the most part. And then if you've traveled nationally, the states that seem to be of concern obviously are New York, Washington, California, and New Jersey. At our practice, if you are feeling like you're concerned, you're coming down with symptoms, if you have fever, if you have a dry cough, if you feel short of breath, or if you're just concerned about what's going on and have questions, we ask that you call our office. So if you are feeling sick, please give our office a call at Balanced with the D physiciancare.com. That's at 904-930-4774. Or for those of you that are members, reach out to us at our emails and we will set you up with a telephone call. We have telemedicine and phone call visit opportunities here at our practice. So whether you are a patient of our practice or just someone in the community listening to this, you can always reach out to us and we can certainly schedule you for a phone visit or telehealth visit. If you're a member of our practice, we will also set you up for a telephone visit or telehealth visit if you're sick and help you work through what's going on and if you should be tested. What's the advantage of testing? The advantage of testing is if you are sick with this virus, we obviously want to keep you isolated. So if you're getting sick with these symptoms, one course of action can be merely just to stay home and stay self-isolated for 14 days, get over whatever's going on, and even when you're feeling better, to make sure you stay home and stay away from others in the community. Or we can get tested and to see if you're positive. And if you are positive, then we are asking that you stay home. And why? Why are we asking you, if you're sick, to stay quarantined? And that's just because so that we reduce the community spread. Again, we're worried about vulnerable populations, people who are sick in nursing homes, people who are older than 60, and people who have underlying immune conditions. If you get this virus, it obviously can cause some severe symptoms that might land you in the hospital or on a ventilator. And so what we want to do is to limit that spread. If you're under 60, you could very well get this virus, and for you, it might be just a minor cold. And you may not even realize that you have it. That's how subtle the symptoms can be. So if, again, you are feeling sick, we ask that you, again, self-isolate and stay home and avoid contact within the community. Or if you need to know for the type of work that you do and you can't work from home, to look at getting tested. So testing, what's available here in the Jacksonville area for testing? Again, in our office, if you're a patient of ours, we ask that you give us a call if you're sick. We'll set you up with a telephone or telehealth visit, and we'll help you figure out if you need to be tested, where you should be tested in the community, and if that place should be us. We do now have swabs for the COVID-19 testing available. However, again, that supply is very limited. And so what we're trying to do is figure out what's happening and whether you need to be tested or not. So there's a couple places in the community. Mayor Curry just had a press conference yesterday that announced one place that is going to be through Baptist Health, and that's going to be at the Prime Osborne Center. That should be opening up today. They're going to be doing testing from 11 a.m. to 7 p.m. It is, again, drive-through testing. You basically have to see, though, a provider through the telehealth system that they are working with. So they are working with a system called Telescope Health. Again, that's TELESCOPE, like you look through a telescope health. And so if you're interested in going to the Prime Osborne Center for testing, you need to download that Telescope app to your phone or go to their website, and they will walk you through the instructions to do an online visit or a visit through the app, and you will be asked questions. And if you're positive for the screening questions, then they will give you an appointment time and phone number to get tested. So that's what is happening through Baptist and the Prime Osborne Center. And again, they're going to be doing testing 7 days a week, but you have to be pre-screened and you have to have an appointment from one of their providers, or they will not see you. You will have to turn away, and they will give you further instructions. The other place that we are aware of for testing is St. Vincent's Ascension. They are doing testing as well at their location. So if you're a part of their system and feel like you need to be tested again for work or because of what's going on, the phone number to the St. Vincent's screening program is 833-981-0712. That's 833-981-0712. So again, similar to the other place, if you're having symptoms that you're concerned about, again, that's fever, dry cough, shortness of breath, and any concern for travel or contact with someone who might be positive, or contact with someone who you think might be immunosuppressed, or if you're a healthcare worker. These are all things that may make it important for you to get tested. And if that's the case, if you call this number at St. Vincent's, they will talk you through it. And if they feel that you meet criteria, again, they will tell you where to go and give you an appointment time to go through their drive-through testing. They will give you an order. So that's, again, the Prime Osborne Center through Baptist, and then St. Vincent's. And then we recently, just this morning, have heard some news, and we will give you more information when we hear more details about this center. But obviously, Everbank, the TIAA Bank field, the federal government is going to be doing testing there in the next couple of days. This testing may not require any pre-screening. So we'll send out some more information in the coming days. But the one thing I do want to let people know is that the Prime Osborne testing through Baptist and the testing through St. Vincent's, when you call their number or you go online to set up a visit through their telehealth site, you will be charged a small fee. That those fees are running $20 to $25. If you have insurance, they may bill the insurance for that, or they may ask you for that fee. And then if you pay that fee, then the government, our government, Mr. Lennon Curry said, will reimburse you at a later date, and they'll be giving you information as far as that goes. So again, those testing centers will require a small fee. Again, for our patients here at Balanced Physician Care, we do have the swabs for testing, and we just ask that you give us a call. We set up a telephone visit with you, and then we'll appropriately set you up for testing. We are doing testing like everyone else. We typically are going to have you drive up to the office, and then me or Arlene will come out and swab your nose and then send it off to Quest or LabCorp for testing. The testing is typically taking about 3 to 4 days to come back. So hopefully that's helpful information for people to know that if they are getting sick, what we're doing around here in the community to get tested, so that you know whether you can go back to work, whether you need to stay self-isolated and stay away from family members. Of course, prevention is the best medicine. So, for those of us that have not gotten sick, I know it's a real interesting time right now. But one of the main principles of those of us in the healthcare field or medical field know is that isolation is the best prevention. Even though it's a struggle, we're social human beings, we want to be out and interacting. Staying away, because the viruses all viruses take advantage of that social contact that we have as human beings for spread. So again, this is spread through respiratory droplets. And so if you sneeze or cough or touch your eyes, and then you touch another surface, that virus, and you have the virus can stay and survive on those hard surfaces. And so that's what makes it difficult when you go out into the community, is that you don't know what you've touched that someone else has touched. And so that's why, we're recommending, if you do go out in the community, to make sure that if you touch something, you don't touch your eyes, nose, mouth before washing your hands. So if you go and you wash your hands with soap and water for 20 seconds, that will kill off the virus. And then for things that you're unable, for your own hands, beyond your hands, any surfaces that you are concerned about, you're able to wash those. So a lot of patients have been asking me, because there has not been a lot of cleaning products to them available. We can send you, if you email us, at our email membership@balancedphysiciancare.com. That's membership@balancedwithadphysiciancare.com. We'll be happy to send you, or you can go to the CDC website, and they have a list of approved cleaning products that will kill viruses. One of the simplest cleaning products is just to make a bleach solution and to use your regular everyday sprayer. So it's 1 gallon of water and a quarter cup of bleach. So you don't need much bleach. If you get a big, huge gallon of bleach, that's going to last you probably for 4 or 5 months. So a quarter cup of bleach to a gallon of water will technically with the CDC, it's a fifth of a cup of bleach. But if anybody knows anything about cooking, it's hard to exactly measure out a fifth of a cup. So I'm recommending to my patients a quarter cup per gallon. And then you can just pour it into a spray bottle, and then you can spray it on any surfaces that you're able to wipe down. And you want to spray it, let it sit for a couple of seconds, and wipe it down, and then it will air dry on its own, and that will clean things off. Obviously, if there are things that require something that's a little less wet, Lysol is a drier spray, and that does provide it. I know it's difficult to get Lysol. So again, we will send you a list of different cleaning products that can clear out the virus for people. We here have medical wipes. And so, I want to emphasize that anybody coming to our office know that we are wiping down every single surface, from the door handles to the bathroom, to the floor, to the chairs, and everything. So if you come to our practice for non-infectious, if you're not sick, if you're coming for other medical reasons like your chronic visit or an acupuncture visit or something else, you can be assured, because of the size of our practice as being small, all of our patients are immediately being put in the room. There is no one sitting in the waiting room, and before and after, all surfaces are cleaned. But on a practical level, for those of us in the community, as we're going out, and as you're trying to clean off your home as you come back from going out, we want to provide this resource for you. It's come across a conversation in a couple of patients now of what you're able to do with what is available out there for you. So again, prevention's the best medicine. Staying home, limiting your contact, cleaning the surfaces. I also want to tell people, as a physician, try to keep your allergies under control. I know a lot of us don't like the allergy medicines that are out there and available over the counter. They may make us feel fatigued. They may make us feel our mouth a little dry. But the more we keep our allergies under control, the less likely we are to have this virus come and bother us. So remember, Claritin, Zyrtec, Allegra are all, antihistamines. So if you have known allergies, seasonal, make sure you're on those medicines if you're having symptoms. Nasacort, Rhinocort, Flonase are all also nasal steroids that are very good for allergies and for sinusitis. If it's difficult to find that available, call your healthcare provider. I'm sure they're more than happy to provide a prescription for that. While Flonase and Nasacort did go over the counter, there are some other steroid nasal sprays that are prescription, and we'd be happy to write those for you as needed. And then, vitamins, eat as healthy as you can. That's always the baseline. Make sure you're getting enough sleep. I know a lot of us are anxious. I think most of us as providers understand the anxiety. And so we're more than happy to help you deal with your anxiety. Just reach out to your primary care provider, but making sure you're getting enough sleep, making sure you're eating lots of fruits and vegetables, and then, taking some vitamins, I think, is a good idea. If you're having a hard time finding vitamins, we are offering, some IV therapy, and that might be something worth considering as well. And I'll talk about that a little bit in a minute. But again, vitamins, a good multivitamin, those are usually in plentiful and good supply. Make sure you're taking that. Some vitamin C, some zinc, those are going to help boost your immune system. There's a couple other herbs that are really good. One of them is elderberry or sambucus. So I would encourage you, to maybe add that in with your regimen. We here at Balanced Physician Care have some immune herbs, and so just reach out to us and we'll tell you what's available. And certainly if it's not available now, we're planning on getting a shipment in the next week of that. We have multivitamins here, and we have quite a few other things available. So just reach out to us if you're interested in anything like that. And again, we are offering IV therapy. One of our basic immune therapies is a Myers cocktail, which we call our Immunity IV. And we are doing those on Monday and Thursday afternoons after 1 o'clock. So if you're interested, we just ask that you give us a call, and we need about 24 to 48 hours notice, and we will have that IV ready for you. So today's Friday. If you wanted to have one by Monday, just give us a call. If you on Monday decide you want to do one, just give us a call and we can have it ready for you and set up on Thursday. So again, our basic Immunity IV includes a lot of really good vitamins, including vitamin C, the B vitamins, magnesium, to really help boost your immune system. If you're having trouble accessing oral vitamins, or if you've got gut problems, this is a really great thing to do by IV to help. And again, the cost for that is $100. We also are offering a little more intense IV treatment. So that's a lot higher than what you can typically take orally, because if you take too much vitamin C, it can kind of cause you some diarrhea. So if you're able to take it through IV, we're able to give you higher doses. So we have a high dose IV vitamin C IV, that's $120. And then we have an intense immunity IV, which includes both a high dose IV vitamin C as well as a Myers cocktail. And I just want to make one comment. I know that there are other, I want to say that our IVs, our IV vitamin C is going to be a lot higher than any other IV clinic. These are intense medical IVs, and the strength, is 15 to 25 grams. And some places may say they have high dose vitamin C, but I would ask them how much vitamin C is in there, because a lot of times high dose is just 500 or 1,000. And again, ours is going to have either 15 grams or 25 grams of vitamin C. And for us, if you are interested in doing that, we just need to check you don't have a condition called G6PD. So what we'll do is we'll make sure that lab is negative and then set you up for that. So please, reach out to us at 904-930-4774, or check out our website, balancedphysiciancare.com, for more information on our IV therapy options. Well, thank you very much today. Hopefully what we've provided for you has been, helpful to know what's going on here in the Jacksonville area as far as the COVID-19 outbreak, as far as what symptoms to look for, and as far as where you can go for testing. We hope to continue to be a community resource during this time. we will always post everything on our website, and you can also check out our Facebook page. Again, the name of our practice is Balanced Physician Care, and the website is balanced with D physiciancare.com. My name is Dr. Sharyl Truty, and as more information comes available, we'll continue to do these Facebook Live or video presentations for you to keep you informed. Thank you very much, and take care and have a great day.